Hi, I'm Dr. Liza Marroquin from Smart Living MD. I'm located in Chula Vista, right across from Sharp Hospital. Today I have a very lovely patient who has come to me with some complaints of brown spots and some spider rings and red spots that she has accumulated throughout her life. She doesn't have many days that she can take off from work, so we chose a procedure that is non-invasive. It's called IPL, or intensive pulse light therapy, or some people refer to it as a photofacial, and it's a non-invasive way of targeting those brown spots that we accumulate with age, and also targeting broken capillaries that also happen with chronic sun exposure. It's relatively easy. I typically numb the patient, and she had 35 minutes of a topical anesthetic so that the procedure is comfortable. So she should be comfortable throughout the procedure and have great results. The downtime is minimal. She can wear makeup right after the procedure. It's important to wear sunscreen. Within a week, you should expect to see a lot of good results. Mainly, all of these brown spots will turn darker and darker and darker, and then they will slough off. The broken capillaries will initially get darker and darker and then disappear. One of the most powerful things that this procedure does, it stimulates its endogenous collagen production. So it's a great anti-aging, non-invasive procedure that can be repeated every 4 weeks to stimulate collagen production.
Dr. Marroquin, I have some questions. My concerns are, I have a chicken pox from my teenager that I'd like to see if I can make that less noticeable, and my fine lines right here from smiling quite frequently, and of course everyone has the crow's feet. I'd like to see if I can soften those up. Plus my hyperpigmentation, I used to go to a lot of beauty trade shows, and so I'm a very perfect candidate for the procedures that we're having, the IPL procedure. So I'd like to lighten these up, and if I can, lighten some of the freckling that I have from various years of sunning.
Okay, so you asked me several questions. So for the hyperpigmentation, today we're treating with IPL, which is a non-invasive way of treating those brown spots. And we talked about the fact that it doesn't have any downtime. You basically put on makeup right after the procedure, and sunblock, of course.
Okay.
And within a week you're fine. Most of the brown spots will slough off.
Perfect.
Now, when you're talking about wrinkles, static wrinkles around the eye and scars, I would recommend something called profractional. I have a Cyton machine. It's an erbium-based laser, and it's a fractional resurfacing. And the downtime for that is you do need about 3 days where you stay at home with a layer of Aquaphor, and by the 3rd day you can start wearing makeup. But that is a procedure that will target scars. It also treats brown spots, but it treats the fine lines. Okay. And it's a wonderful procedure. Now, both those procedures, the profractional and the IPL, will stimulate collagen production.
Perfect.
The nasolabial folds that you're talking about, they're mild. So I would suggest first stimulating your own endogenous production of collagen, treating the brown spots with the IPL, doing the profractional, and you might not even need filler because I see very little, very minimal line there. So I would rather stimulate your own production of collagen, take away the fine wrinkles, the scars with the profractional, the broken capillaries and the brown spots with the IPL, and then if you have any residual line there, then we can put a filler.
That sounds like a plan.
As a preventative measure, we can also do Botox to prevent more crow's lines from forming and the lines that you get from the facial expressions that we make.
Okay, sounds like a plan. Thank
Excellent.
you.
Okay.
I look forward to
3. Okay. And
oh, I'm not a 4?
No, you're not a 4. So
4 is for darker, a
yes,
little bit darker. Okay.
Yes. So My technique is I treat your whole face twice. Depending on your skin type, I use different fluents, and then I do a couple of passes with a higher power, higher fluents to each hyperpigmented lesion. I have great results with that because you get the collagen stimulation everywhere. But then I can go back and do very aggressive treatments to the lesions that are very prominent and big. And then I will change the filter so that I can treat the broken capillaries along your nose. Okay? I'm going to put a layer of ultrasound gel. It's a protective barrier for the machine. It's a little cold.
And of course all this is being administered after numbing.
Yes, so you have been, I put a topical anesthetic for about, I would say 35 minutes at least. So the machine right now is warming up. It's getting to the desired temperature that I want, which is 15 degrees centigrade. I'm using the 550 wavelength because I'm trying to target her brown spots. If I wanted to do blue light or target her acne, I would use 420. If I wanted to do skin tightening, I would use this filter and so forth. So based on the patient's condition, I choose the given wavelength of the light therapy. So I typically start with the lowest parameter or the starting recommended parameters for her skin type and her condition, and based on her response, based on her tolerance, I will adjust it accordingly. Okay, so now and how are you doing?
I'm doing just fine. It's relatively painless.
Good. You okay?
Mm-hmm. Yes, thank you.
Since you did so well with the first pass in the starting parameters and you've responded so well, I'm going to change and go up in the fluence. I'm going to increase the parameters because I think you're going to get a much better result. Okay?
Terrific. I'm totally fine with that. It's relatively painless.
Okay, 1, 2, 3. And you're doing fabulous.
And I will look beautiful.
You are beautiful, and it's going to only enhance your beauty. Now on the forehead, I go back down on the fluence because it is a little bit more painful. Although you are a superstar patient. Okay, now I'm going to take off my glasses and just see how you're responding. And you are responding fabulously. So what I think I'm going to do now is I'm going to put an adapter, a circular adapter, and just target each lesion individually more aggressively. When I do this last part of my treatment, I call targeted lesion therapy. I put an adapter so that I can go specifically at each hyperpigmented lesion at a much higher fluence. I take off my glasses so that I can be more precise, but I do have to close my eyes because you don't want to have any eye injury from the light therapy. So 1, 2, 3. How did you do?
Fine.
1, 2, 3. And I will do a couple of passes in each lesion, and then I'll see how they each responded, and I'll adjust accordingly. And which one is the one that really bothers you? You told me?
It's above my left eyebrow and right on the eyelid, actually.
I see one here and on the side.
When I was a
Okay.
teenager, and if I
Okay.
make my little lines across my